While we would all love to leave COVID-19 behind, the virus is still here and making some people very sick, especially older adults. The new updated COVID-19 vaccine is the most effective way to give your body the ability to keep the COVID virus from causing you harm. That's why CDC recommends everyone 6 months and older get 1 dose of the updated COVID-19 vaccine ahead of the fall and winter season. This recommendation was based on extensive data and clinical trials. As a doctor, a mom, a wife, a daughter, and head of the CDC, I would not recommend anything to others that I wouldn't recommend for my own family. That's why my 9 and 11-year-old daughters, my husband, my parents, and I will all be rolling up our sleeves to get our updated COVID-19 vaccine. I encourage you to get your own updated COVID vaccine and make sure everyone in your family who's 6 months and older does so as well. Don't forget, it's also a good time to get your flu shot if you haven't already. Check vaccines.gov to find a location near you and get your vaccine. And if you have any questions about the vaccine, please talk to your doctor.
So that message was brought to you by our newly appointed, relatively new, newly appointed CDC Director, Dr. Mandy Cohen. And she wants you to know that you need to go ahead, you and your family need to go ahead and get these updated shots. You need to get these updated shots. You know, she would not recommend it if she and her entire family have not taken it, right? So you need to go get these shots. She's taken it. Everybody at the CDC, they have taken it as well, right? And everything is okay. It is, it's been tested extensively. They have data and clinical trials to show this. So Pfizer did their studies on 10 mice, and you know, everything is okay. They're not going to share with us the information about the 10 mice. Moderna, they did their clinical trials on 50 people, 50. And, you know, everything is okay. There may have been one adverse event, but it is nothing of significance. They believe in the product. It is safe and effective. The benefits outweigh the risk. It will stop you from going into the hospital, so no hospitalizations. It is going to stop you from catching COVID or spreading COVID, right? And it is something that you definitely need to get right away. You, your family, your friends, everyone, just go out there, because the CDC is always right, 100% right, just as they were regarding the mask, and just as they were regarding the other shots that are not working right now. Trust the FDA, right? As she said, she and her entire family, they've gotten it and they're perfectly fine, and she would not recommend it if she and her family didn't get it, right? What else do I need to let you know? Yeah, so, you know, yeah, go ahead. Just go ahead and, you know, get these shots because the CDC says so. The government sponsored regulatory agency said so. And if they said so, then they are 100% right. Don't question it. Don't ask any questions regarding the whole situation. Just roll up your sleeves, just as she said, and go ahead and get your updated shot. All right. Anything else in terms of, you know, this message from the CDC? I'll put articles there in the description box so that you can read it for yourself. All right. But just wanted to share that with you. KP here from the No Justice Report. If you want to hear what I think, I have a different opinion. If you want to hear a different opinion from me, just you know, follow me on the links in the description box, and you will be enlightened a little bit more. All right. Thanks for following. Shout outs to all my subscribers. Stay woke, stay well, and stay red.